Hi, everyone. I'm Kyle Bechet, and this is the AAF Exchange, a podcast from the American Action Forum, where experts provide clear, data-driven insights into today's economic and domestic policy issues. Welcome, and thank you for tuning in.
I have a plan for Medicare for all.
The plan that Senator Sanders and I and others support, Medicare for all, is how you get to single payer.
Now, here's how I would do it. It's very similar. I would call it Medicare for all who want it. Then it will be a very natural glide path to the single-payer environment.
We will have Medicare for all when tens of millions of people are prepared to stand up and tell the insurance companies and the drug companies that their day is gone, that health care is a human right.
You just heard a number of current and former presidential candidates arguing for Medicare for all in one form or another, including the senators Bernie Sanders and Elizabeth Warren, who are perhaps the most vocal proponents of this policy. But why is Medicare for all at the center of the presidential campaign right now? And what would happen if it gets enacted? My name is Andrew Evans, and I'm your host for today's podcast episode. Today I'm talking with Christopher Holt, the Director of Healthcare Policy here at the American Action Forum. Chris, thanks for taking the time.
Thanks for having me.
Let's start with the political element. What's driving the popularity of Medicare for all right now?
So it's an interesting question, especially at this moment, because I'm not sure that Medicare for all is as popular as we've thought that it has been. In fact, it seems like it may be decreasing in popularity. But if the question is what's driving the interest in Medicare for all in the Democratic primary, then I think there's really two things that are going on. One is just generally, I think, a frustration on the part of Democrats that the Affordable Care Act didn't cover all Americans, right? That there's still roughly 30 million uninsured Americans. So that's part of it. And then I think among Democrat primary voters and among sort of that progressive part of the Democrat electorate, there is just this sense that it's a responsibility of the government to take care of this. So it's more than just making sure everyone has coverage. It's a desire to have the government do it.
I'm interested in this failure of the Affordable Care Act that you mentioned. We know that some people are still uninsured. That's a well-known fact. The Affordable Care Act didn't cover everybody. But can you just sort of break down for us what's the nature of the problem more precisely that Medicare for all is trying to solve?
Yeah, so it's really interesting when you actually look at what the insurance, the status of the uninsured is today, that Medicare for all is probably not a very effective solution to that, right? So before the ACA, there were about 45 million people who were uninsured annually. And it is important to know that doesn't mean it was 45 million people who didn't have insurance at all in a calendar year. It means there was 45 million people who at some point during the year did not have insurance coverage. So that is I think, an important thing to keep in mind. So in 2016, and the numbers haven't changed a lot, in 2016 there were about 28 million people who were uninsured to that same criteria. So the Affordable Care Act brought down the uninsured rate, but maybe not as dramatically as Democrats had hoped. And part of the reason was the Supreme Court decision that made the Medicaid expansion that was part of that legislation optional for states. So not all the states took it. And so currently, of the 28 or so million uninsured Americans, there are about 2.5 million people who are in that Medicaid coverage gap. So people who are below 100% of the federal poverty line and live in states that didn't expand Medicaid.
So these would be states like probably predominantly in the South,
Texas and Florida
controlled.
Actually are probably the big two. Yeah. So there's that, right? And then the others, as you start to look at it, there's about 5 million people who are eligible for employer-sponsored insurance and just haven't bought it. Okay, so they're making a choice not to do that.
Would that just be for financial reasons, or?
I mean, there could be innumerable reasons why someone decides not to do that. And particularly in the case of an employer-sponsored insurance, it's probably not really a financial problem. There's about 5.5 million people who are eligible for subsidies through the ACA if they purchased individual market coverage through the exchange, who just are choosing not to do that. That may be for financial reasons, at least in part. But in any case, so those are people who do have access to the coverage that the ACA was seeking to provide, and they aren't taking advantage of it. Then there's about 2.5 million children who are uninsured, who are eligible for some federal program, whether it's CHIP or another kind of federal program. They're just not enrolled. If they needed
the
Children's Health Insurance Program, if they needed health care and they went to the hospital, they would get enrolled. The hospital would take care of that. And then there are about 4 million adults who are eligible for Medicaid or some other kind of public insurance, and they just aren't signed up. Okay, and then last, there's about 5.5 million undocumented immigrants. That is a different policy problem, and I think it's correct that both Sanders and Warren in their proposals wouldn't cover those people either.
Oh, interesting.
So really, we're talking about taking people who are eligible for care and forcing them into it, right? And then about 2.5 million people who right now can't get health insurance. Oh, there's one other group. There's about 3 million people who have incomes in excess of 400% of the federal poverty line. Those are people who could buy individual market insurance. They don't have an offer of employer-sponsored insurance, but they make so much money that they're not eligible for any kind of subsidies.
So, yeah, just to sort of summarize what you're saying there, it seems like of the 25 million people who are uninsured right now, 10% or under 10% of those people are actually the ones that Medicare for All would tangibly be helping by putting them in a different situation where they would now have access to it.
Yeah, that's correct.
Thanks for explaining those numbers. That's really helpful. You mentioned that Medicare for All is perhaps becoming less popular, and it's just not as popular overall as people tend to think. What do you mean by that? Explain that some more.
Yeah, so I think if you watch the history of the debate, when we first started hearing a lot about Medicare for All, it was. I think they were tying this idea of single payer to Medicare because Medicare in general is very popular and it polls well. And so if you can tie into that popularity, then you can sort of bank on that a little bit, right? And the reality is that the proposals that are being called Medicare for All don't really have a lot to do with Medicare. They are complete elimination of the current healthcare system and putting a new single-payer program in. But nonetheless, I think we saw polling back in so Kaiser Family Foundation has done a ton of polling on this. So you go back to say June of 2017, about 59% of Americans, not Democrat primary voters, but 59% of Americans said that they supported Medicare for All. I thought that was a good idea. Now, as we talk about it, when you parse the specifics, that starts to change. But that was probably, I guess it was 57% in 2017. So that's close to a high water mark. It's stayed relatively stable. In March of 2018, it did get up to about 59%. This year, in March, it was about 57%. Kaiser came out with polling last month, showed that now popularity or support for Medicare for All is about 51%. So that's a pretty precipitous decline since it was relatively stable until the earlier part of this year. And so I think a couple things are happening. I think as the Democratic primary season has gotten in full force, that there has been a splintering on this messaging. So I think for a while, Democrats were really unified around the message of Medicare for All, but not the underlying policy. As Medicare for All has gotten tied to Sanders and Warren, and specifically to a single-payer system that eliminates employer market insurance and eliminates Medicare, really eliminates individual market insurance, we've seen other Democrats, and especially other Democrats in the primary, start to back away a little bit. So you've seen Kamala Harris, for example, kind of every which way, whether or not she supports Medicare for All or not. And more recently, since Elizabeth Warren has released her proposal, a number of the other candidates, Biden comes to mind, have been very aggressive in critiquing Medicare for All. So at the same time that we've seen the popularity of Medicare for All coming down, what Kaiser found is that the popularity of things like a Medicare buy-in or a public option, those are all, again, for all Americans, not just Democrat voters, those are all in the 70% support for those kinds of ideas. So it's interesting that Medicare for All is continuing to dominate the Democratic primary. I think there's a couple reasons, and this is somewhat speculative, but I still think that the progressive segment of the party is really committed to the idea of single payer. Even still, when you ask Democrats who support when you ask Americans who support Medicare for All why they support it, about 40% say they support it because they want everyone to have coverage. So that's why you're starting to see appeal from for some of these proposals that don't force people into one program. But nonetheless, I think among Democrat primary voters, there still is this support for this single payer idea, and so that's pushing it a little bit. I think the other thing is really that Elizabeth Warren in particular, and Bernie Sanders as well, sort of staked their campaigns on this and have really pushed it. And I think it's also interesting that we'll see if this bears out, but at least right now, Senator Warren's sort of polling seems to kind of have plateaued a little bit. At the same time that we're starting to see Medicare for All decrease in popularity among Democratic primary voters. So that is going to be interesting to watch as she's tied herself to this, and I think it will show us whether or not Medicare for All as a sort of unifying principle for Democrats to campaign on is going to stay salient, because it may be that we're starting to see Democrats realize maybe we should go a little bit more narrow. And in fact, the other thing that Kaiser found was that of Democrats, 55% of Democrats said that they support or they would prefer a candidate who wants to build on the ACA rather than a candidate who wants to pull the ACA apart and do something like Medicare for All.
That's so interesting. So it seems like as the policy is better known and better defined, it's the policy debate that's sort of driving down the popularity potentially. That's
no, I think that's true. Kaiser did sort of ask questions about does this make you more or less likely to support Medicare for All, and things like eliminating private insurance or wait times or not being able to see a particular doctor. All these kinds of things drove down people's support for Medicare for All, particularly when people realize that their health insurance might change. They become a lot less interested.
Let's think about a little bit about the policy aspect of Medicare for All. You mentioned that a Medicare for All policy, which I guess we can just define for the conversation as the government is paying for everything. The government.
It's a single payer national health plan.
Yeah, so a single payer national health care plan. What would be, or sort of what is its relationship to Medicare program? That's sort of the broad question I have. Elizabeth Warren explicitly models her proposal on Medicare. This is what she says. Private insurers had administrative costs of 12% of premiums collected in 2017, while Medicare, in contrast, kept its administrative costs down to 2.3%. So she's drawing this contrast, and she's saying that her plan will be as efficient as Medicare, saying Medicare is great because it's so efficient. So my question is Medicare really that good? Is it as good as people are saying? Is it, to maybe put it more specifically, is Medicare well equipped to solve the problem that Medicare for All is trying to solve? Is it a good model?
Yeah, so again, I think the primary reason that we see people, proponents of a single payer system, targeting the idea of Medicare for All is simply because of the built-in goodwill towards Medicare. People believe Medicare is good. People believe Medicare is cost-effective. People are happy with Medicare. Americans writ large are happy with Medicare. So I think that's the primary reason you're seeing the connection being made. The administrative cost one is an interesting one, and I don't want to get too far down that rabbit trail. The number that she's citing as Medicare administrative costs comes from the trustees report. There's a lot of question about what is or isn't included in that. When the Urban Institute, which is by no means conservative, estimated the cost of Medicare for All, they put the administrative costs at around 6%. It's kind of consistent with where CBO has projected. And part of what Warren is doing there and using that 2.3%, that's part of how she's just arguing that she can pay for Medicare for All is, well, I'll get this rather than that 6% that other people are using. I think when we modeled it, we used at least 6% we used something like 6% for administrative costs. So I'm not sure how realistic that 2.3% number is. So that would be the first thing.
Okay. What about in terms of payments and how it pays doctors? I know it pays doctors significantly less.
So this is the other way that Warren is explicitly tying her proposal to Medicare, and this is where I think most of the time when people talk about Medicare for all, the thing that's most directly related to Medicare is the payment rates. So Warren says that she'll tie provider rates to 110% of what Medicare currently pays, and then she's got this stuff on how she's going to pay 70% of what, or she's going to reduce drug costs by 70% from what Medicare pays. That's a little more confusing, but she is tying herself to the Medicare payment rates, and the 110% isn't crazy, right? Medicare, according to the American Hospital Association, Medicare pays about 88% of cost. Maybe a little less, maybe 86%. Medicaid pays about 88% of cost. Private insurance pays about 144% of cost. That has shifted over time. It used to be that Medicare paid a lot closer to cost and sometimes even over cost. Private insurance paid a lot less than it does now. But that number isn't out of line with what costs might be.
What about in terms of efficiency? I know some people attribute rising healthcare costs in the United States to Medicare fee-for-service, the sort of traditional Medicare that we think of when we think of Medicare. Is Medicare efficient in terms of how it uses care and how its care is distributed throughout the population, if to put it that way?
Yeah, so maybe another way to get at what you're talking about is to think about the fiscal sustainability of Medicare right now. And so we can just look at the last trustees report. The Medicare trustees report annually on the financial outlook for Medicare. And in the 2019 trustees report, they informed us that the Hospital Trust Fund will be bankrupt by 2026. Medicare's cost shortfall in 2018 was $363 billion. So Medicare spent $740 billion, and it took in both payroll taxes and premiums about $377 billion. So there's a substantial shortfall. It represented 46% of our deficit in 2018. So Medicare's not exactly on a sustainable course as it is. Since the program was enacted, there's been a cash shortfall of about $5.1 trillion. And we make up for that by simply borrowing revenue from other federal revenues. And so that has an effect on the rest of the federal budget. I think according to the trustees, the actual, I don't say it this way, but if you parse their numbers, the actual contribution of Medicare to the national debt is about a third. It's about 33% of the national debt is Medicare. So I do think it's problematic to tie a future federal program to Medicare in that sense, right? The idea that we can expand Medicare to just encompass everyone is just kind of ridiculous.
It seems like there are two sides to that efficiency question, though. One is that maybe we're just not taxing people enough. We're just not being honest about the costs, and we're not taxing enough. The other side would be the costs of the program are rising unsustainably and rapidly. Is it possible to see which side, where the problem lies, whether it lies in just not taxing enough or whether the program's costs are actually rising rapidly?
So I think objectively, right, we aren't bringing in enough revenue to cover the expenditures. Medicare is targeting, elderly population. There's a lot of reasons why Medicare costs are increasing, including the fact that we're seeing the baby boomers retire with fewer people paying into these things. So there's a lot of just demographic issues that are driving some of this. Medical technology is getting more expensive. This is something that we see in the rest of the healthcare system too, and we would have to think about how we would handle in a national system, right? But medical technology, so medications, medical devices, procedures, all of that is getting more expensive. People are living longer. We are able to treat and in some cases cure things that used to just kill people. And so all of this is driving increased utilization of healthcare, and it's making healthcare more expensive. That's clearly a problem in Medicare that has an older population, but it's going to be a problem anywhere.
Mm-hmm. Mm-hmm. Seems like most of those are not structural to Medicare, though.
No.
Yeah. Okay. That's helpful. I want to think a little bit about the impact. What kinds of impacts would you see beyond more people being insured? What kind of impacts would you see from implementing Medicare for All in the abstract?
Yeah. So, I mean, very speculative. But I think also I would just say I don't think. I don't think Medicare for All is viable. I don't think Medicare for All is viable in the first term of a President Warren. I'm not sure that it's viable this decade. I just don't think the American people are there. So
politically viable.
Yeah. It's just, I don't think Democrats are unified around that. So I think if you actually had a scenario where we were talking about implementing policy, we would end up talking about something short of Medicare for All. It's just not a realistic objective. That said, I think the kind of system that Senator Sanders is talking about, that Senator Warren is talking about, doesn't actually look like a lot of other single-payer systems in the world. Most single-payer systems still have roles for private insurance. They tend to have more regional variation, regional control. They're not nearly as sort of top-down, one-size-fits-all, federally managed and mandated. So the best comparison is probably to what they're proposing is probably the British NHS, which is popular in Britain. But when you look at the differences between their system and ours, there are huge access issues, delays for treatment, decisions made. So rationing happens in healthcare to one degree or another, no matter how healthcare is structured. But very clear government rationing of care. The kinds of treatments that are available in the United States are just either not available at all in Great Britain, or they come to Great Britain much later. And so, in general, I think people would be looking at longer wait times, harder time getting into access healthcare, fewer innovative treatments. In the long run, particularly if we're going to reduce drug costs to the degree that Senator Warren thinks, you're going to see less innovation. So there will be fewer new treatments. And so just in general, I would say access and quality over the long run would decline.
That's helpful. Thanks. One last question for you. Bernie Sanders said at a debate back in July that the function of the healthcare system today is not to provide high-quality healthcare to everybody. The function is to provide, and you can just totally imagine him saying this, the function is to provide billions in profits, I think he said, to insurance companies. Would Medicare for All eliminate the profit motive from the healthcare sector, and is this a good thing?
So I think as long as there are private companies in healthcare, you're not going to eliminate profit motive. You can certainly constrain the ability to obtain profit. And realistically, a lot of hospitals are at least definitionally are nonprofit. There are nonprofit insurers, so there are nonprofit actors in the healthcare space. The danger in making profit in healthcare a sort of a blanket evil, like something to be opposed, is that anything that is risky and requires a lot of investment needs profit, right, to motivate that investment. And so it would impact different aspects of the healthcare system differently to try to constrain profit as a driver, but certainly in the innovative things like drugs and devices, a lack of profit will lead to a constricting of innovation.
Very good. So, Chris, normally at the end of a conversation, we ask a sort of, funny personal question. I think last time we talked about the novels you've been reading. This time, I'd like to ask a bit about the calculator that you've noted on Elizabeth Warren's website for what Medicare for All means for you. What does it mean for you? Tell me about this calculator. What does Medicare for All mean for you, Chris?
Yeah, so Elizabeth Warren helpfully on her website in her plan section where she has a plan for this and a plan for that, all paid for using the same pay-fors. She has a calculator to help you understand the implications of Medicare for All, her Medicare for All plan for your bottom line. And so the calculator asks you to consider all of the ways that you pay for healthcare in a year. So the money that comes out of your paycheck, money that you're putting into an HSA, any sort of co-pays and deductibles, and plug all of that in. That's the sort of first piece of information. So let's say I spend, $10,000 a year on healthcare. All right, so I put $10,000 in, and then it asks me some other questions about whether or not I've foregone care, things like that. And then I click calculate, and it tells me how much money I will now have as a result of Medicare for All. And it turns out I will have $10,000 as a result of Medicare for All. So the calculation tells me, that whatever I put in apparently is just going to go directly into my paycheck, which last I checked is not actually a calculation, but it also isn't consistent with what she put out in the proposal either. I mean, at a minimum, even if my income went up by $10,000, she talks about how she's going to tax that. So right there, it's not exactly $10,000. I just think it's an absurd calculator.
Very good. Well, everybody will have to go check out and see what it means for you. Although I guess Chris just told you how the calculation works.
Yeah,
saved us all some time.
Yeah, one of our team members put in $1 million, and it turns out Medicare for All is gonna give him $1 million. So.
Very good. Well, Chris, thanks so much for coming on. Really appreciate it.
Thank you for having me.
I hope you enjoyed this conversation. Tune back in for our next episode, where our experts will provide clear, data-driven insights into today's economic and domestic issues. Don't forget to subscribe to iTunes, Spotify, or Google Play. I'd also encourage you to check out any of the links in our show notes and also follow us on social media to learn more about AAF.